Every so often we hear of medical mysteries or health cases that really baffle experts or doctors.
Yeah, now maybe it is a miraculous healing, or maybe it's some bizarre health symptoms. For instance, this is Landon Jones. Landon's parents have to beg him to eat because he's lost his ability to be hungry and thirsty. Doctors can't explain it, but they think maybe it has something to do with his brain. They think maybe he is the only person in the world who has this condition.
There's also the case of Nick Hess, the man who at times felt drunk even though he hadn't had any alcohol. He would vomit, dry heave, and slur his speech. After 3 years, doctors finally diagnosed him with something called autobrewery syndrome. Basically, it's excessive yeast in the gut. And after changing his diet, Nick says he feels much better.
Well, there is another mystery that is baffling medical experts. There's a woman named Lenny who already has a rare disorder that seems to have developed another symptom that doctors around the country simply can't diagnose. As we hear from reporter Lynn Kawano, she bleeds from her eyes and mouth without warning or explanation. Before we hear this story, we want to let you know some of these images that you're about to see, they can be disturbing.
Born on August 30th, 1990, Lenny Ikeda had a normal, happy childhood. She loved dolls and stuffed animals, tried soccer, swimming, and gymnastics, and she was very close to her family, in particular, her sister Mavis. In 2008, she graduated from Pearl City High School. It was supposed to be one of the happiest years of her life.
What happens when your life comes to an end, but people aren't ready to let you go?
Instead, it was the start of her darkest years.
I was ready to go and I was ready to leave it all behind. In 2008, my eyes started to get infected, and at that time, we didn't know what it was.
Bruises started mysteriously appearing in her eyes, on her arms, chest, back, and abdomen.
It's spontaneous, like I never know. All I know is when I feel the sharp pains and it's like a hammer hitting my bones, and that's when I know it's gonna show up, and then by then it's too late.
The bruising triggered concern that she was being abused.
They asked me constantly, and you know, are you being beaten? Are you being beaten by your parents, by your boyfriend?
After numerous doctor's visits, including one to the Mayo Clinic in Rochester, Minnesota, she was diagnosed with Gardner-Diamond syndrome, a rare condition that results in unexplained bruising. It's often associated with stress and anxiety.
I hurt all the time. I don't want to cry for the way I feel inside.
Lenny says she was stressed, but not more than any other teenage girl.
When I have the bruising, I'm in pain, you know, and just, it wakes me up sometimes. Or like, I can't sleep. Would this be going on for 9 years? 10 years, 20 years.
2 years later, a shocking symptom emerged: spontaneous and uncontrollable bleeding from her mouth. Her tongue would split open and stay like that for days.
It was just oozing, like to the point where at the very first time I had to hold a garbage can and it would just come out.
Doctors cauterized the base of her tongue and cut blood vessels, painful surgeries that she endured 11 times. The doctor said they couldn't keep doing the surgeries because she'd lose taste and feeling.
I break every single day that I have to wake up and I see the pool of blood on my bed.
A year later, it got worse. The blood started coming from her eyes. This is video Lenny's mother took.
Surprisingly, when it bleeds, it doesn't hurt. It's what leads up to the bleeding. So like I'll feel pressure in my eyes will bleed like puffy and like raw, and then that's when I know like my eyes are gonna bleed.
It happens mostly overnight, but can drip like tears during the day. Sometimes it happens from both her eyes and her tongue.
Like, I don't want people to treat me differently because they do. You know, some people do. And they think that that girl's strange, I don't want to be around her, or, you know, what if she's contagious? It hurts me like it would hurt any other person being bullied.
Her condition is not contagious, but it is a mystery. 30 doctors, ophthalmologists, internists, hematologists have all seen her, and no one can diagnose the bleeding. They don't even know if it's actually related to Gardner-Diamond syndrome. She has even seen a priest for spiritual healing.
It happened again this morning, and just to see her in that condition with just blood covering her face, it's really sad. And we want to do something to help her, but unfortunately we're stuck right now, and we don't know what to do.
I'll usually wake her up and I'll say, honey, let's go clean up, Or if it's not that much, I'll usually just wipe her up so that she just goes back to sleep.
Linny's mom has been to every doctor appointment with her.
The hardest part for me is she'll come to me and she goes, Mom, when is this gonna end? And I can't tell her. I don't know.
I don't want to cry for the way I feel inside. I just want someone to hold me. I'm alone in the dark. Please try to find me.
Years ago, Linny started writing in a journal and using a calendar to keep track of her moods, what she ate, what she did, to see if there's any pattern on what triggers the bruising or bleeding. But she can't find a common denominator. Lately, the bruising has gotten worse.
What happens if these are the cards you're dealt with?
Reading old entries in Linny's journal, it's clear how the condition affected her.
My kids mean the world to me, and I want her to live for her, not for us.
Of course, your heart will ache for her, but I look at her as so much more. She's my little sister, but she's stronger than I'll ever be. She doesn't just curl up in a ball and say, why me?
Linny is a teaching assistant. She has had 7 blood transfusions and is constantly visiting doctors, but she hasn't missed many work days.
That's where my strength and my courage comes from. It's not from me, but the people around me.
She does say the darkest days are now behind her, as she is learning to live with this painful and unexplained condition. But she is growing desperate for answers.
What I'm looking for is just that bit of hope. You want to see the light at the end of the tunnel, and I can't see it. No matter what I do, or no matter how hard I try to pray, or try to change my lifestyle, I can't see it. And I just hope that when someone sees this, that they can be that light of hope. Just hold me tight. That moment, I could feel the light.
Can you imagine? Now, Linny's bleeding mostly happens between 2 a.m. and 5 a.m. Now, there have been other cases of people who bleed from the eyes. Linny's family is aware of those cases, but those people don't have the combination of bruising and bleeding. Also, it seems like the other cases improve with time. In Linny's case, it just seems to be getting worse.
That is heartbreaking.
Amazing.
Now, although that disorder is rare, there are other bleeding disorders that aren't so rare. In fact, did you know that some over-the-counter medication may be to blame?
So joining us today via Skype to tell us more about it is Dr. Robert Ferber, family medicine physician and hospitalist with the Nanticoke Health Services. Dr. Ferber, thank you so much for joining us.
Thank you for inviting me.
So we're talking about Linny's case here, and the Diamond-Gardner syndrome is rare. There do seem to be other cases across the nation, though, where people might have one of those symptoms. What causes that?
Well, first of all, let me clarify that I'm certainly not a specialist in blood diseases or hematology. In fact, yesterday when I first heard about this condition, I had never heard of it before. And so I had to do some reading, on the internet like anyone else to find out about it. And I'm certainly sorry to hear that this woman is suffering from this problem. It certainly sounds like a really difficult one. But in any medical situation like this, a physician would, approach it in the same way. We try to take a history of the problem, an examination of the person, and then some detail about their past medical history, perhaps medications that they use. Then, of course, there's laboratory testing. Of course, this condition is so very unusual it's really hard to say exactly what would be found, although characteristically nothing is found to explain it, and they're left with the mystery.
Yeah, it certainly is a mystery. Now, there are other bleeding disorders that people can have. What are they?
Well, that's a really big question, but there's all sorts of problems with bleeding that are pretty common in medicine. Some of them, we all are familiar with, people who have frequent nosebleeds or people who bruise easily. But in general, we think of the bleeding problems in two general ways. One are the hereditary conditions, and the other are the acquired conditions. Now, the hereditary ones include such things as classic hemophilia. There's other conditions that don't always appear in childhood like that one does, such as von Willebrand's disease. Many people have never heard of this and hear of it for the first time when they have a tooth pulled and continue to have a lot of problems with bleeding afterwards. So there's a lot of different hereditary causes, but there's an even a larger amount of acquired conditions. For example, I'm sure you're aware of people who are quite a bit older who have very fragile skin and get easily bruised with minor injury. And this is really part of aging for those people. And of course, then there's some very, very serious problems that can occur as well.
I think almost all of us take over-the-counter medications for like headaches or maybe other ailments, but these can actually cause internal bleeding?
I'm really glad you asked that question. I think a lot of people don't realize this. Probably one of the most common medicines taken is aspirin. And aspirin is specifically used for its ability to inhibit bleeding in the normal person. But not only can it lead to bleeding, but it can even cause ulcers, which can be pretty significant. Some other common over-the-counter medicines include the arthritis medicines, such as ibuprofen or naproxen. These too can cause ulcers as well as promote bleeding. It's also important to realize that some of the supplements that people take can influence it. Such things as fish oil, which a lot of people take, can make bleeding a little bit more likely. And there's even some herbal supplements that can lead to it as well.
Wow, I didn't know about that,
Yeah.
especially the fish oil. Okay, so are there some signs or symptoms that we can look for
Sure.
internal bleeding?
Well, there's obviously the ones such as Linny has, which is, really quite evident when you, wake up and have blood on your pillow. But sometimes it can be more subtle. For example, modest amounts of blood in the urine tends to give the urine a tea color, very much like iced tea color. And a lot of people wouldn't recognize that as blood, which could indeed be, a marker for a serious kidney problem. Similarly, if a person has a bleeding ulcer, the blood becomes digested in smaller quantities and can lead to your stool becoming tarry and very black in color. And a lot of people, of course, would not recognize that as digested blood. But those are the kinds of things your doctor would certainly ask about.
Dr. Ferber, just because we bruise easily, that doesn't necessarily mean we have a bleeding disorder, right?
Well, it's certainly a good thing because I think all of us find bruises on ourselves and wonder where they came from. I think that, the occasional bruise, the occasional nosebleed doesn't necessarily mean much of anything. But if it were frequent and extensive, certainly it would be worth bringing up to your doctor.
All right.
Dr. Robert Farber with Nanticoke, thank you so much. Appreciate your time with us today.
Thank you.
And to read more about these different bleeding disorders, go to WBOC.com, click on our picture at the top of the page. We talked about mysterious conditions. Another condition that still remains a mystery to some is post-traumatic stress disorder. Still ahead on DelmarvaLife, we'll take you to a local yoga class designed to help military veterans fight another battle, this one on the home front. How the connection between mind, body, and soul is giving them peace.
We'll also learn more about a program that's helping current military members get comfortable in the kitchen. You're going to find out how Dorm to Gorm got its start and why it's giving airmen and women so much more than just culinary capability. But first, since we've been talking a lot about health today, Dr. Oz has more on how to keep your bones and joints in tip-top shape.
Hi, I'm Dr. Oz. Give your bones and joints the support that they need. Practice good posture. It keeps your body perfectly aligned and reduces painful wear and tear. Show your feet some love with well-cushioned shoes. The right shoes can reduce joint pressure from your knees to your lower back. Don't ignore the core. Strengthening these muscles gives you all-over support.